Good morning, everybody. Pleasingly, New South Wales has satisfied another important hurdle. 75% of our state have at least the first dose of vaccine, and we will all rest easy once we get to at least 80% first dose, knowing full well that we'll hit that double 80% vaccination rate as soon as we can. 42% of our citizens are fully vaccinated, a number which is very pleasingly inching towards that 70% double vaccination rate we're all looking forward to, which we still estimate will be around mid-October. To 8 p.m. last night, there were 1,480 cases of community transmission and regrettably 9 deaths, and we extend our deepest condolences to the loved ones of those people who lost their lives with COVID. Dr. Gal today will in particular highlight the suburbs where we're calling out people to come and get vaccinated. It's really important for us to move forward, and whilst parts of Western Sydney and southwestern Sydney are demonstrating outstanding results, there are other parts of Greater Sydney that we'd like to see the vaccination rates go up, and Dr. Gal will call some of those areas up. And there are also areas where they join some of these communities and might actually be at risk of having more cases in the next few weeks, and we want to make sure that people are protected all around the state, but also that we all move forward to ensure we get those vaccination rates as high as possible. Very pleasingly today we have with us Professor Christine McCartney. She's a specialist at Sydney's Children's Hospital at Westmead, as well as a number of other important roles, and she's going to allay any concerns about the impact of Delta on children and how parents and children can move forward, especially with schools returning next month. And I really want to thank Professor McCartney for the great work she and her colleagues do, but also for the time today, which we know what a struggle it's been for families who are home learning, for parents who are overseeing home learning, as well as undertaking their own work responsibilities and household responsibilities. And we just want to say to everybody, thank you for your patience, and please have the opportunity to hear directly from an expert as to what Delta means for children, especially those under 12. Dr. Gow will now give the health update. The Deputy Premier will talk about the regions, and as we've foreshadowed, we'll be talking about what it means, what the future of lockdowns mean for regional New South Wales later this week, and then Professor McCartney will give her update. Thank you.
Thank you very much, Premier, and good morning, everybody. Till 8 p.m. last night, there were 1,480 locally acquired cases of COVID-19 in New South Wales, and there were 0 overseas acquired cases. We had 130,341 tests reported till 8 p.m. last night. So again, very good testing numbers, and thank you to everybody coming forward promptly for testing if you have even the mildest of symptoms. Currently, there are about 11,000 people with COVID-19 who are being cared for by New South Wales Health, and the vast majority of those, over 90%, are being cared for in the community or in New South Wales Health's special health accommodation. There are currently 1,136 people with COVID-19 admitted to hospital. 194 people are in intensive care, and 78 of those are currently requiring ventilation. Of the 194 people in ICU, 158 are not vaccinated. Sadly, today we are reporting the deaths of 9 people with COVID-19. They are a man in his 60s from Dubbo who died in Prince Alfred Hospital. He is not vaccinated. He was not vaccinated and had some significant underlying health conditions. We also report the death of a man in his 90s from southeastern Sydney who died at St George Hospital. He was a resident of the St George Aged Care Facility in Bexley, where he acquired his infection, and his death is the 3rd death linked to this aged care facility. We're also reporting the tragic death of a man in his 20s from Western Sydney who died in Nepean Hospital. He was not vaccinated and also had serious underlying health conditions. We are also reporting the death of a man in his 80s from southeastern Sydney who died at Prince of Wales, a woman in her 60s from western Sydney, Agnes Banks, who died at Nepean Hospital, a man in his 70s from Western Sydney who died at St Vincent's Hospital, a man in his 80s from Western Sydney who died at Westmead Hospital, a man in his 70s from southwestern Sydney who died at Liverpool, and a man in his 40s from southwestern Sydney who also died at Liverpool Hospital. 7 of the 9 cases of people who died that we're reporting today were not vaccinated. 1 person had had 1 dose and 1 person had had 2 doses, and all those individuals had underlying health conditions. On behalf of New South Wales Health, I do extend my deepest sympathies to the families of those individuals who have lost their lives. Today, I'd like to draw attention to a few areas for people to come forward for vaccination and for testing and to be aware, particularly of symptoms. We've had a sewage detection in the Bonny Hills area of the mid-north coast. We're currently unaware of any cases in the Bonny Hills area, so if you do live locally, please be aware for symptoms and please come forward for testing. In terms of our suburbs of concern, we remain concerned about suburbs that we've previously mentioned in the Western Sydney and Southwestern Sydney area, and we encourage residents of those areas to come forward for vaccination as soon as you can. We're also concerned about case numbers in the areas of Glebe, Waterloo, Redfern and Marrickville, and I'd like to encourage the residents of those suburbs as well to please come forward for vaccination. The Sydney Local Health District has set up some special clinics, Pfizer clinics, where bookings can be made or walk-in appointments can be made for residents of those areas. And they are clinics at the Peter Forsyth Auditorium in Glebe, the PCYC in Marrickville, and the West Leagues Club in Ashfield. So please, if you live in those suburbs, come forward to get vaccinated. Please look out for symptoms and get tested if you have even the mildest of symptoms. I'd also like to thank all residents of those 12 LGAs of concern in particular for coming forward. We're really seeing great vaccination numbers from people in those areas, which is fantastic. And I'd particularly like to ask people who live in suburbs around the Liverpool area and the suburbs around the Parramatta area as well to come forward for vaccination. So thank you very much.